Slow down.
Good evening. I'd like to bring the Social Service Committee meeting attention to order. Our first order on the agenda on May the 23rd is approving the previous meetings minutes.
So moved.
It's so moved. I hear a second. In a second, all in favor?
Aye.
Any opposition? Hearing none, it's approved. Okay. Commissioner Gail Cohagen is up, authorizing agreement with the New York State Department of Health regarding the reimbursement for administrative costs pertaining to the Children with Special Healthcare Needs Program.
Yes.
Commissioner,
Good evening.
good evening.
We're first.
Yes, you are.
Switched it up a little bit. Okay, so the department would like to request legislative action for the permission to enter into a contractual agreement with New York State DOH as it pertains to the Children with Special Health Needs Program. This is a mandated service. We have received an awards letter from DOH that our program will be funded for the next 3 years, beginning from October 1st, 2017 to October 30th, 2020. And this provides the opportunity to meet the needs of those children within our special needs program for any health care needs that may come to light, such as if they're in need of a special bed or any programs or services to address their needs.
Okay, sounds good. Are there any questions from anybody pertaining to this?
I make a motion.
She make a motion. Do I hear a second?
Second.
Motion is second. All in favor?
Aye.
Aye. Any opposition? Hearing none, it's unanimous. The next one, Commissioner, is authorizing agreement regarding the transportation of children with special needs to education and therapy programs.
Yes, thank you. So again, the department requests legislative action to renew our contract with Raja for the period of September 1st, 2017 to August 31st, 2018 for the 6 zones that they facilitate transportation for those children that have been identified with special needs services that are in need of programming and transportation to get to those programming. Raja has been facilitating this service for the last 1.5 years, and we've had no concerns with their facilitation of that service. We've actually found that we've been able to streamline in terms of the services and resolving any issues that may come to light because we have one provider that is providing the transportation for the 6 zones. We will say that we have seen some cost increase, but that is not reflective of the transportation services. That's actually reflective of the number of children that are now being provided services. We've actually seen a 50% increase in the number of children that are actually being referred to these programs. There have been a number of programs, such as within Albany City School District. They've started a UPK program, so we're seeing a lot more children that are being assessed and being identified and being referred for services. And they, as part of this being a mandated program, they are entitled to transportation services.
Question?
About how many children are served by this program, Commissioner?
We are over the 300 mark at this point in time, like I said, and before we were trending about 230 to 250, but there has been a significant increase that we've seen related to the number of children, and we attribute that in part to just because of there are more children with the UPK program, that there's just more of an opportunity for children to be identified early on and to proactively be referred to these services. So it's a good thing, but it's at a cost.
Another question, Ms. Lockhart.
Commissioner, is there one diagnosis or service that is predominantly over others with the children? Are we seeing a pattern?
No, we're not. It's pretty much across the board, whether it's for the OT, the PT, the speech, it's pretty much across the board. I will say that on the special ed, in terms of special ed itinerant services, that might be overall where we're seeing more of the numbers, but pretty much it's spread out in terms of the needs that they're being assessed for.
Thank you.
Paul?
Commissioner, I see that this is a professional services procurement?
Yes.
So you went out for an RFP?
We issued an RFP in 2015,
Okay.
so I think we're in our second year of renewal.
Okay, so this is an extension, it's not a new contract authorization?
It's not, it's a renewal. No. So when we issue the RFP, the language is in there that it can be renewed for an additional 2 years. So this is,
Where is this fall in the cycle?
I want to say that this might be the second year. We're in 2017. I want to say the RFP was issued in 2015.
I believe this is
So
the
this is
final
a
year?
s-
Final.
This is the final year, thank you. So we're in
Okay,
the
so
third year
This
of,
you would do an RFP later in the year for
again,
next year, and if there were other potential bidders,
they would be considered,
They would
right?
be
Their
considered.
proposals would be scored according to the criteria.
Okay. Now, thank you.
Are there any further questions? Do I hear a motion? The motion has been made, and a second. Motion is second. All in approval?
Aye.
Hearing no opposition? It's
Madam
unanimous.
Chair.
Yes, sir, I'm sorry.
Could I ask a question on behalf of a member who's not here?
Oh, yeah.
The zones that were broken out, east of Lake Avenue, south of Albany City, so the south of Albany City mean that it includes Ravenna, Selkirk, everything, all of the county south of the city, and then when it refers to north of Albany City, it means everything north of the city of Albany?
Correct.
So these are not 6 zones in the city, this is the
Oh,
entire
no,
county?
no, this is the entire
Okay.
Albany County.
Thank you very much.
And I actually have copies of the breakout of the zones, so if you'd like that, you can
If someone
certainly.
provided it,
Pass it around.
that'd be great.
Take one and pass it around. Okay, is there any further questions? Okay. We vote on that, didn't we?
Yeah, we did.
Okay, so okay. Last one. Number 3. Amended the 2017 Department of Children, Youth, and Family Service budget, the suicide prevention funding.
Yes, the department has received funding through, for our SPEC committee, the Suicide Prevention Education Committee. We actually presented an RLA last month with requesting permission to apply for the grant, and we've actually now received the funding in the amount of $4,500. So we're back to request permission to be able to accept the funding and amend the budget to incorporate that funding as $4,500. It will go towards having campaign material to bring awareness to suicide, and in collaboration with the school districts, programs and services in order to address when suicides, either someone has completed suicide or someone is at risk of suicide, and how to be able to engage and provide programs and services. We're also looking to strengthen our post-vention response. So in the aftermath of someone having completed suicide, really galvanizing community resources to be able to respond to whether it's the school or the community and provide those services.
This is the launching of this program, right?
Actually, the Suicide Prevention Education Committee launched in 2009
Okay.
when there was a completion of a suicide in Guilderland. And since then, the committee has been in existence, and so this is just additional funding that has been received to really further the work of the committee.
Oh, good. Are there any questions?
I'll make a motion.
Mr. Bullock has a question.
You have a high incidence of veteran suicide, you know.
I don't have
Children.
that specific data, just because the data that we have really pertains to the children, but I will say that the data from 2010 to 2015 that is based on census data as well as the CDC actually had for the age category of 45 to 64, and 89, roughly 90% so there were 75 persons, in the category of 45 to 64 that completed suicide in Albany County. And we also find that it tends to be white men that are completing suicide at a higher rate in Albany County of a percentage of 90%
Thank you very much.
in that age group.
Thanks a lot, Commissioner.
But as to whether or not they're veterans, I could not specify for that. I don't, it's not to say that that might not be available, but I don't have it specifically, but it's certainly something we could.
Looking at the PTSD epidemic and wondering, and saw some statistic on veteran suicide that was increasing, so it's kind of alarming.
Okay.
Thank you.
Oh, you're welcome.
Any further questions? Do I hear motion? Motion's made. I hear second. It's been second. All in favor? Any against? Sounds like it's the unanimous vote. Thanks a lot, Commissioner Gale. Okay. Number 4. Oh, no, Michelle is here. Isn't she? I didn't see you. Good. I'm sorry.
Yeah, that's fine.
Michelle McClay. Department of Social Services. Good evening, Commissioner. Okay, first up for you, number 4, authorize an agreement with the New York State Office of Temporary Disabilities Assistance and to Interfaith Partnership for the Homeless and amended the 2017 Department of Social Services budget.
Yes, we're asking permission to accept basically pass-through money. It's 100% state funding
Right.
for $36,000 to, for this past Code Blue season,
Code Blue.
which is actually over now, for Interfaith, which kept open their Safe Haven drop-in center during the daytime and on weekends when it was below 32 degrees. So this is just to reimburse them for that service already provided.
This is a good code blue program. Anybody have any questions about this? Any concerns? Do I hear a motion? Motion's been made. Do I hear a second? It's been seconded. All in favor? Thank you. Unanimous. Okay, number 5, authorizing the submission of a grant application regarding a process and technology improvement grant to improve customer services for the SNAP application and recipients.
Yes, we're looking for permission to apply for a USDA grant to obtain 3 kiosks for our reception area, as well as 20 scanners for our SNAP workers to increase our ability to collect documents and scan those documents into our processing system, our application processing system. So we're looking for the kiosks for people, there's a lot of documentation that is required to be provided to be eligible for SNAP, birth certificates, income verification, et cetera. And people drop in our reception area. This will allow them to go directly to the kiosk, put the materials in, get a receipt for having dropped that off, and then it is scanned into our network to be filed by the SNAP workers. So hopefully an easier in and out, if we get it.
Yeah. Well, I remember me saying that I'm going to stop in to visit the SNAP unit. Now I've got a real good reason to do it, Dallas.
Yes,
Thank you
this
for
will be
your
exciting if we get
presentation. Yes,
this.
it is. Do I have a question from someone?
Yeah, I
Patty
do.
Lockhart?
So when somebody comes and applies for SNAP, they need to provide certain documents. So
Lots of
this
them.
is like ahead of meeting with a caseworker, or do they have a caseworker and then they go and gather their documents and then can just drop them off, so to speak?
Right, in SNAP, you can actually apply online.
Yeah.
But you
Okay.
still have to provide a lot of documentation.
Right.
So a lot of what happens is people mail them into us,
Okay.
or they drop them off at the office and they end up in a box, and then they
Right.
have to be sent upstairs, and then they have to be scanned in, and then
Right.
Right.
So this will allow clients to come in, scan their documents, keep their originals, which
Okay.
they want, to make
Right.
sure that they keep their original birth certificate, for instance,
Yeah.
and get a receipt that they dropped it off, and it goes right into,
Right.
it'll be scanned already, ready for the worker to put it into the file, the electronic file.
The people that mail them, you'll still have to.
Right, people that drop them off,
Yeah.
people mail them, so, right, people that
Yeah.
mail them, that's what the scanners on the desks are for
Okay.
also. So for people that mail them, like who live in the hill towns, don't come in, mail them in, the worker will be able to scan them right at their desk.
Great.
So,
Now, this SNAP program also satisfy customers who are not pure welfare recipients too, am I right? Yeah, okay, low-income people, senior
Right,
citizens.
right.
Okay.
There's a lot of
A lot
people
of
just have
people
SNAP.
just have SNAP and
Yeah.
nothing, no
almost
other
20,000
services.
people
Yes,
in
20,000
Albany
people on the
County.
SNAP program, great. You have a question?
Well, yeah, I mean, SNAP is all over the news today.
Yes,
because of the federal
it
budget
is.
stuff. And I heard a statistic that there were 44 million people who were SNAP recipients in the nation. So to know that there
That's a
were
lot.
20,000 in Albany Albany County is a big number in a county with what we have, 310,000 people.
310,000 residents.
Yeah.
So it's still a pretty big number. Can you tell us how that's trending, or how it's trended over, say, the last 5 years? Are we on our way up? Are we on our way down? Are we flat?
I think we're pretty flat. I should know that. It's in our annual
It increased
report.
slightly, but over the last, okay, so at the beginning of the financial crisis, there was a pretty big push on the state level to get people enrolled, and that was primarily spearheaded by the Cuomo administration. And they were successful with that, and then that's kind of bared out over time at that level, which is the level that the commissioner just referred to. That being said, there is some evidence, and this is evidence that's pretty consistent across the state, that there is still some level of penetration that the program could have in the community, but Albany County is in line with other counties of our comparable size and demographics in terms of the amount or the percentage, proportion of the population on the program. But we haven't seen a remarkable increase in some years now.
Is the SNAP program indeterminate, or are you on it for a certain amount of time?
Well, there's many different categories of being on SNAP. For instance, if you apply for temporary assistance, you're automatically eligible for SNAP, depending on how many people are in your household, et cetera. If you're a disabled person, you'll be into a different category. If you're between the ages of 18 and 50, and you're a single individual on SNAP, you have to participate in work requirements. And there's all these rules. There's something called ABODS that was just started last year, a couple years ago. Able-bodied adults without dependents.
Yes.
They have to enter into work training, and they can only have 3 months of SNAP in a 36-month period. So there's all kinds of rules already set up for different categories of individuals.
So your 2,000 is a blended
Yeah, so
population
everybody
across
who's,
all those
yeah.
categories?
Right.
Thank you.
Are there any more questions about SNAP? None? Do I hear a motion? Motion's made. I hear a second. It's been seconded. All in favor? Thank you,
Thank
Commissioner.
you.
We'll set a date for a SNAP visit, okay?
Oh, yeah.
It'll be
Tell me and I'll go
snappy
with you,
too.
Linda.
All right. The Nursing Home Administration is here tonight. Number 6, authorize an agreement with the Guardian Consultant Services regarding pharmacy consultant services at the nursing home. Mr. Lasky.
Hi, how are you?
Good evening.
The nursing home sent out an RFP. There was only one bidder, which happens to be our current pharmacy consultant, Guardian Consulting Services. It was for a 3-year contract for a total of the 3 years, for the 3 years, of $126,399. This is a mandated service of Medicare and Medicaid participation.
Okay. Is there any questions?
Quick
Oh, I'm
question.
sorry, Paul. Go ahead.
If it's mandated of Medicaid and Medicare, it shows here that it's 100% county cost. Is that something that we then get reimbursed?
A portion of it will be reimbursed,
Like,
yes.
Based on our...
It goes on the cost report, and based on Medicaid days, a portion is reimbursed,
Okay,
yes.
so that is somewhat, it isn't really 100%.
Correct.
To the county. Okay, thank you.
Are there any more questions? I hear a motion. Motion's made. Second? Second's made. All in favor? Any opposition? Hearing none. Number 7, authorize an agreement with the Chem RX Pharmacy LLC regarding pharmacy services for the nursing home.
ChemRx is our current vendor. This contract was originally written for 1-year terms, so we could have 3 one-year terms within the contract. We are requesting that we go into or approve the 2nd year with ChemRx.
Okay. Any questions about this renewal? Go
Just
ahead,
had the
Paul.
same question. Is this also, it shows is 100% county cost?
Yeah, this is a not-to-exceed cost of $240,000, and the same would be for any nursing home cost. It goes on a cost report, and a portion of it will be paid by Medicaid and/or Medicare reimbursement.
Legislators, you have any questions? Do I hear a motion? Motion's made, seconded, all in favor?
Aye.
Unanimous, okay. Number 8, authorize an agreement with the Stanley Convergent Security Solutions for a service plan regarding installation of security equipment at the nursing home.
Stanley is our company that maintains and installed our security system, which is the card access system on many of our doors. The cost of maintaining the system will be $595 a month, that's for the maintenance charge, or $21,420 for the entire contract period of 3 years. Reading through their agreement, and I put it here, the scope of services is clear that Monday through Friday, 8 to 4, is the normal service plan. So there is a possibility that we may need their services outside the plan, which would be an additional cost. So I requested over the 3-year period an additional $2,580, or a total of $24,000 for the 3-year contract.
Sounds reasonable. Do you have any questions, legislators? No questions? I have here a vote. All in favor? Any opposition? Hearing none, that's unanimous. Number 9, authorize an agreement with the National Grid regarding high-efficiency plumbing installation at the nursing home.
We had a meeting with National Grid. They have a special program. It's called Commercial Energy Efficient Program, RISE Engineering. They have been retained by National Grid. They have surveyed our building. This is at no cost to the nursing home or the county. They will replace all of the equipment within the facility that will save water, okay, and therefore conserve energy. So as an example, you know, all of the, I guess the ends of the faucet, whatever it is.
Yeah,
The aerators, thank you. That's what we're naming. The aerators will be put on every faucet. Now, a lot of people have asked me this, well, we're renovating the nursing home. Why would we do all of this work now? Well, a lot of the equipment that's being utilized will be able to be transferred to the new equipment if in fact we are changing it. And number 2, it'll be approximately 2 years, and we will save $24,000 to $30,000 per year on energy and or water usage over that 2-year period. So even if there's certain products that wouldn't be able to be reused, it still will be done by National Grid onto the new equipment.
Okay, good. Cost savings. Paul?
Do you get your water from the Layton Water District?
Yes.
Yes,
Okay.
Is that a good thing?
I get mine from the
Good water.
faucet.
Oh, okay, all right, just checking.
Pepsi bottles.
He goes, I get mine from the faucet.
I pay a lot of money for
There
it.
will be an exam on the word aerator, so be mindful of that, okay?
I'll make a motion.
You make a motion, you're getting crazy now.
Let me get the
Here,
next one.
second. Second, all in favor? Any opposition? Hearing none? And thank you, Mr. Slacky.
Oh, thank you very much. Appreciate it.
Motion to adjourn?
You're welcome.
Motion to adjourn. Okay, thanks, everybody.